Yeah. So although we all know someone, and maybe our personal lives and families have been affected by this, we always need to know a lot more. And that's why we have communities that are dedicated just to dementia, especially those that are caused by Alzheimer's. And that's why we have organizations like Alzheimer's. So if you know someone who is challenged by this illness, certainly Alzheimer's Association is a huge, huge benefit. Always think about them. They have one of the easiest websites that I can ever remember, alz.org. So they keep it simple. So this is Sarah Sobel, and she is one of the specialists that does a lot of advocacy, research, and presentations for the Alzheimer's. You have 30 minutes.
All right. Let me get situated because I was asked to record this. So I got to make sure I get that. Okay. So good morning, everybody. Thank you so much for having me here today. Kelsey and Stacy, I guess they left the room, but Lisa, thank you so much. So again, my name is Sarah Sobel, and I am the Advocacy and Government Affairs Coordinator for the Alzheimer's Association, the Cleveland area chapter. We just did another poll, or we just had a poll, I just have another one. How many of you have either used our services before, have referred to us before, have called our 1-800 number before? Okay, I would hope there would be more, but that's okay. Just to give you a quick overview of the association, we are a nonprofit organization. We provide our services free to families and to the community. The only thing we do charge for on occasion are professional programs, which usually involve CEUs. And we serve 5 counties. We serve Lorain County, Cuyahoga County, Lake Geauga, and Ashtabula counties. So there are 6 other chapters in Ohio that serve the rest of the population. So if you have a family or a friend or family member in Summit County, which is typically, sometimes we get some overlap, the Greater East Ohio chapter would be the entity that would service them. So we do a ton of programming, as you may or may not be aware of. We have a lot of education programs out in the community. We have a lot of direct care programming, which typically consists of care consultation, which is kind of like a case management program, a one-on-one meeting with families. We have an early stage program, so folks who are in the early stages of the disease come together for some peer-to-peer support as well as some education. Geez, what else do we have? We have probably, I think, the most important thing, which is our 1-800 helpline. This is a phone number, and everything that's on our website can also be accessed through that phone number. It is 1-800-272-3900. It is available 24 hours a day, 7 days a week, to anybody and everybody who has a question about Alzheimer's, related dementia, resources in the community, just wants to know more, or maybe needs some support in the middle of the night. We actually have real people who answer the phone at 3 o'clock in the morning for somebody who just needs some resources or support at that time. So in addition to our direct care and support, we have our education programs. We also have advocacy and government affairs work, which is my baby, which is what is really important to me, and which is, I think, as much as we care for folks who are living with the disease now, the only way we can prevent this disease from growing, from affecting more people, is by advocating for the future. So that's really important to me, because I don't want anybody to be affected by this disease. My grandmother had a form of dementia. I still remember her last moments, and I remember her not being vocal but squeezing my hand, and that was her way of communicating with me. So if you haven't been touched by the disease already, you will be. And I think that's why learning how to advocate for your loved ones, for your communities now, is going to be really important in the future when you do need to take action. and to be ready to do that. So I thought in your packets I would give you a couple of different handouts. I'm going to refer to them, but by no means, I'm a visual learner, so I need to have something in front of me. So I'll be referring to that on occasion. But first, I have another multimedia piece for you. How many of you have seen the Facts and Figures report?
Extra packets.
Extra packets? Let me see. I have 2 extra packets. So, lucky ones will be.
Oh, okay. Go ahead.
Oh. Anybody else need one? Sorry, I didn't bring more. So Facts and Figures is a report from the Alzheimer's Association that comes out every year that really kind of captures the state of Alzheimer's disease in that year. And sometimes they focus on a specific population. Last year they focused on women as caregivers and the added burden that women typically have. This year they talked about the undiagnosed. So hopefully this will actually play and you can kind of get a glimpse of what that is.
Official door opener.
One disease, millions of lives permanently disrupted. Today, there are over 5 million Americans living with Alzheimer's disease. But Alzheimer's is taking more than memories. It's taking lives. What few realize is that Alzheimer's kills more people than breast cancer and prostate cancer combined. And Alzheimer's is the only disease in the top 10 causes of death that can't be slowed, stopped, or prevented. From 2000 to 2013, while deaths from other diseases decreased significantly, Alzheimer's deaths increased 71%. But equally disturbing, many living with Alzheimer's say they are not being told their diagnosis. While more than 90% of people with the most common types of cancer say they are told their diagnosis, only 45% of people with Alzheimer's or their caregivers say they are told. The economic toll is staggering too. In 2015, it will cost the nation $226 billion to care for people with Alzheimer's. By 2030, 72 million baby boomers will reach an age of greater risk. The fact is, everyone's at risk for Alzheimer's, even you. But everyone can help, especially you. We're the Alzheimer's Association, the brains behind saving yours. Join us.
Okay. So, what stood out from that video to you guys?
Why are people not being told their diagnosis?
Yeah, it's 45%. That's not acceptable to me.
Meaning the physicians are not telling them when they know it, or that people don't know it.
It's probably part of it, both, I think. Yes.
Sounds like there's been an increase in the number of cases compared to historically.
Mm-hmm.
Use as one.
Baby boomers.
Awareness, right. So,
Misdiagnosis.
Yeah.
I think you all are on the right target. I mean, I think, to me, what's staggering about this year's report is that only 45% of those with a diagnosis are aware. I think part of it is probably maybe folks are diagnosed too late in the disease. So they have progressed where they're not cognitively aware of their diagnosis. That could be part of it. It could be that physicians don't want to say Alzheimer's. They are okay with maybe saying dementia. We've heard some families who call our helpline and say, that was the case with their doctor. It could also be that the physicians that they're going to are not, experts in the field. Maybe it's a family practitioner that sees, the person, and they're not familiar with Alzheimer's, and they don't refer to a neurologist or the appropriate physician. So I think there are a lot of reasons why that 45% is there. To me, that's still not acceptable. The fact that there's so many other people who will be impacted by this disease, and we still don't have one single test that says this is Alzheimer's. I think we're getting there, but right now this is why research is so important, why advocacy is so important. So I just want to pick out a few pieces of that report that to me are really important for advocacy and for government affairs work, because all of this stuff can mean something on a personal level, but when we're talking to our government officials to take action on this epidemic, this is what they need to see. They also need to hear the stories of people who are impacted by the disease, but I'll talk about that a little bit later. So the numbers are increasing. The message is this is an epidemic that is growing and that we need to take action now because it's not going away. So we know right now 5.3 million Americans are living with the disease. That number is expected to triple. That's really nerve-wracking. And then another thing that resonates with government affairs folks is the economics of this. I mean, this is a costly disease, not only mentally and physically to families, but financially to families as well, but also financially to the American society. One thing that stood out for me, and which is also in your packets, is that it costs $226 billion in the American economy. That's quite significant. It's not just chump change. And right now we know that 1 in 5 Medicare dollars are spent on Alzheimer's disease. By the year 2050, that's going to be 1 in 3 Medicare dollars. So obviously this is a disease that is starting to use up a lot of resources of our public health systems. So, and then another piece that stood out to me, and I don't think it was talked about in the video, but it's in your handout, was the unpaid caregiver fact. We have about, the estimate is that friends and family cover about 18 billion hours of unpaid care. That's valued at about $218 billion. So translate that to loss of productivity, loss of the workforce, because folks have to care for their loved ones, and they're not getting paid for that by a system or by some kind of entity like that. So all of these things are really important when we're communicating why this disease cannot be ignored by public officials. And so we talked about these statistics, they're all important, but then I mentioned this, what does that mean to the individual? What does that mean, or how do all these statistics translate to a personal story? Because government affairs people, legislators, they want to hear from their constituents, okay, so 5.3 million Americans are living with this disease. How do you factor into this? What's your story? What's your personal connection? So Kelsey, thank you for asking everybody to raise their hand and asking who has been affected by this disease, because I think that's the more and more hands that are raised, the more and more that our legislators will respond. And the more voices that they hear and the more persistent we are about asking for what we want, the more they will be forced to take action. So obviously, these statistics, they create, to me, the best way I can say it is they create the perfect storm for taking action. So I just wanted to run down a few of these, policy priorities that, the association has determined are what is going to end the epidemic, or what is going to help provide care and support for folks who are living with this disease now and prevent future generations from being impacted by Alzheimer's and other dementias in the future. So probably the first thing that I think is pretty important, how many of you have heard of NAPA? Okay, I'm impressed, because I'm a big policy nerd. Full disclosure, I actually watch C-SPAN on occasion. But so when I've talked to, my friends and family members about, NAPA and legislation and appropriations, there I start to glaze over. So I appreciate that a few of you actually know what I'm talking about. But for the rest of you who don't, who are not policy wonks like me, NAPA is was the National Alzheimer's Project Act. It's actually now law. This was introduced in Congress back in 2011 as a national coordinated effort to find an effective treatment or cure by the year 2025, which is only 10. Ooh, I haven't had enough coffee yet. It's only 10 years away at this point. So what Congress did and what the White House did once it was passed into law was they went around the country and hosted listening sessions. And unfortunately, I wasn't part of that, which I wish I was, because there was one in Cleveland. But they went around the country and they got input from community members as to, what do you want our federal government to do for Alzheimer's? Or what are the issues that are impacting you today? And what do you see happening in the future? And so they took all of this input from across the country and they put it into the national plan to address Alzheimer's. And right now that is actually housed at HHS, which is the Health and Human Services Bureau of the federal government. Some of you are like, yeah, cool. That was like government stuff. So anyway, what was really monumental about this piece of legislation that was actually signed into law was that for the first time, we actually had a national coordinated effort to address this disease. And what was really impactful about it is that it involved all of the bureaus of government. So we have the NIH, the National Institutes of Health, involved. The Department of Justice is involved with this. Veterans Affairs Department is involved with this. HUD, the Housing and Urban Development Department, is involved in this. So all these different government agencies are working together to address Alzheimer's disease. And they as in the plan, defined there were 5 overarching goals that they wanted to do or to achieve by 2025. And the first was to prevent and effectively treat Alzheimer's disease by 2025. That's a pretty lofty goal, I'd say, but it's an important one. The second, enhance care quality and efficiency. Again, efficiency and quality, those are all big buzzwords, I think for care delivery, and it's something, again, that's very important, that's keeping us on target, that we're providing the best care that we can to folks who are currently living with the disease, and the systems that support that. It also expands supports for people with Alzheimer's and their families. Duh. I think that's a huge one, and that's really important because right now, what support systems are out there for folks living with Alzheimer's? The Alzheimer's Association, Medicare, Medicaid. There's some systems that help, but obviously there are a lot of gaps in between those systems and things that some of the systems don't cover. So that goal is really important to kind of cover what those gaps are. Then enhance public awareness and engagement. That's a huge, huge goal for me. That resonates a lot with me because, as we know, people still don't like to talk about Alzheimer's disease. People don't know what Alzheimer's disease is. People still think it's just part of getting older, and there's still a stigma about talking about it. So enhancing public awareness and engaging in those conversations is a very appropriate goal for this plan to have. And then improve data to track the progress of this plan. So what happened with that goal is now there is an annual update that the plan reports out to the community. In your handout, you do have a little fact sheet that has information if you would like to learn more about the plan. It is kind of wonky, so feel free to browse if you need a little bit of assistance going to sleep at night, or if you're like me and you find that fascinating. But what's really great about this is that it keeps going, and that our federal government is being held accountable to achieve those goals. We're getting there, but again, we're not quite there yet. And I believe the plan just released their 2015 update, if not this month, last month. So you can see with each year where we are on that goal for 2025, which is pretty important because not all government entities are as transparent about the results that they're and the progress that they're making. So I wanted to talk about that briefly because I think that is pretty monumental for a country that needs to address this problem because it's not going away. Now, with that, another piece that was really monumental, one of the goals, again, was to ensure a coordinated effort for preventing and treating Alzheimer's by 2025. So how are they going to do that? With research funding. So what happened was, let's see, I don't remember when it was, a couple of years ago, when the research community at NIH, the National Institutes of Health, they determined that they need a commitment of $2 billion for research annually to appropriately move forward with this goal of finding a cure or treatment by 2025. So that's what they told Congress. The research community came up with this figure. The people who know what they're doing came up with this figure. But in the past, it was Congress who decided, well, we can maybe offer, $50 million for research, and this was the appropriated amount. And that was what the research community ended up getting. So what happened last year was Congress introduced the Alzheimer's Accountability Act. And what that act said was it would require scientists at NIH, so again, the folks who are working on finding effective cures and treatments on a daily basis, they would be submitting an annual Alzheimer's research budget proposal directly to Congress, thus avoiding this whole bureaucratic process that typically follows with an appropriations cycle. And what this budget would entail is that our members of Congress would see, oh, this is the amount that they need in this year to make sure that they are meeting the goals of the national plan to address Alzheimer's. So this bill was actually passed into law within a year. And for any of you who follow politics, that is very rare that a bill actually passes into law from introduction to signage within a year. That is very, very, very rare, but it happened. And it all happened because of Alzheimer's advocates saying this needs to happen. We can't, jump through hoops. We don't have time to wait for the bureaucratic process to ensure that our researchers are getting the funding they need to get to the goal of finding an effective cure and treatment by 2025. So this passed into law. So it, again, just supports the goals of the national plan to address Alzheimer's disease, which is really important. And if you'd like to learn more about it, I can get you a handout, but just know that it's law. It's already done. So as advocates, we don't have to advocate for that law or for that bill. So those two pieces are happening. Another piece, so we talked about the plan, which is a coordinated effort. Then the Alzheimer's Accountability Act really focused more on the funding of the research piece. Then we have another piece of legislation which is called the Hope for Alzheimer's Act. And this really focuses on the care and support piece. And this bill has been introduced, I think at least 3 times, and it still hasn't gotten passed yet, which is a little frustrating, but what it does is it provides Medicare coverage for a comprehensive care planning package or bundle following a dementia diagnosis. So it involves a dementia diagnosis included in a person's medical record, so that if somebody goes to another physician or, for example, an individual who has a diagnosis of Alzheimer's goes to their heart doctor and they're just not communicating correctly, the doctor can look in their medical record and see they have a diagnosis. Let me ask some other questions that I might not ask had I not known that there was a diagnosis of Alzheimer's disease. That's really important for practitioners, for family members, for the individual as well, because they're going to get better care that way. And then it also requires, this is a new piece to the bill's introduction this year, is that it requires the Department of Health and Human Services to educate providers about the new benefit and to identify any barriers individuals face in accessing care planning. So this bill incorporates some sort of accountability for providers to ensure that they're not talking about care planning after a diagnosis, if that makes sense. It's very policy wonky, but again, your Hope for Alzheimer's handout hopefully will explain that in a little bit greater detail than what I'm able to do in the 30 minutes that I have. So this is a piece of legislation that is still garnering or gathering co-sponsors, still gathering support from our legislators. So right now Senator Brown has signed on as a co-sponsor. Congressman Joyce has signed on as a co-sponsor. He's out east. Congresswoman Marcia Fudge, who covers this area partly, is still not a co-sponsor. And we are working with her to sign on to this legislation, because she has in the past, but for some reason this year she's slow to react. So just putting it out there that if you have relationships with their office, you are more than welcome to call them and ask, why haven't you signed on? So that's a piece of advocacy right there.
Good job.
Thank you. So, Mercy Captor, I'm trying to remember if she has, off the top of my head, again, I know she has in the past. I'm not sure if she signed on yet. But she is one of our top supporters. So it could just be that they're busy right now, which is a lame excuse, in my opinion. But
So what would stop them from signing on? I mean, is there something that's bundled with this that they're vehemently against, that other priorities?
other priorities, yeah. One thing about this bill, it doesn't cost any money. It hasn't been scored by the Congressional Budget Office. So that's a question we get asked a lot. What if I sign on to this, am I adding costs, to things? And no, you're not. You're just bundling services together. So it could be more beneficial for offices so that they can just bill one code rather than, two separate or three separate codes. And there are a lot of nuances with that. I know the way that the language was crafted is that it's not, there are legal implications for saying that it's a package versus a bundle for services with Medicare, and folks who do billing, if I'm messing that up, I apologize. But, obviously those are some reasons why folks maybe have not signed on yet. Yeah.
Real quick question,
Yeah.
because all the people you mentioned, there's Democrats.
Mm-hmm.
Is this a partisan issue for some reason?
No,
Okay.
it is not. Senator Portman, we have probably monthly phone calls with his office, and it's not one way or the other for him. It's just a monetary issue because he's a fiscal conservative. So for the HOPE Act, I'm not sure what's keeping him, but for other issues, he's publicly said that he supports an investment in research. So it should not be a partisan issue whatsoever. We have a lot of supporters who are on both sides So, yes.
You haven't mentioned the private sector at all, and I would think that Big Pharma would be very interested in this because it's a huge, huge potential market. Any observations or comments on this?
That's a fantastic question. And so, let's see how to phrase that response. So pharma is involved in some of the specific clinical trials. There is a national network of a trial called the DIAN-2 trial, which is dominantly inherent Alzheimer's. I'm totally going to botch the name of it, but there is a specific pharmaceutical company that's associated with that. So I think pharma is involved, just not at the scale we need it to be. Personally, this is not my Alzheimer's hat. Before coming to the Alzheimer's Association, I worked for the HIV and AIDS community. And the only way we got to where we were was because we had pharmaceutical companies involved at the start. Yeah. So I think when we talk about Alzheimer's disease, I think having pharma at the table is really important. I think they're probably going to be a much larger player in the future once they see that it's becoming profitable for them, which once the research makes the case for it, I think they'll be able to be more involved. But that's a fantastic question, and I wish legislators were asking that more often. Yes?
I heard the terms dementia and Alzheimer's kind of used it interchangeably.
Mm-hmm.
I don't really understand what the difference is between those. Could you
Sure. Yeah. So there is a distinct difference between Alzheimer's and dementia. The way that I like to make sense of it is that dementia is the umbrella term for disorders and diseases that cause cognitive challenges, memory challenges, mood challenge, not challenges, but changes, things like that. So everything that our brain typically does for us, movement, things like that. There are diseases and disorders like Alzheimer's disease, like Parkinson's disease, like frontotemporal dementia that manifests itself in dementia symptoms. So there are over 100 different types of dementias out there. Alzheimer's disease accounts for about 60 to 70% of all cases. So that's why people sometimes use them interchangeably because it's the most common. But Alzheimer's is a very specific diagnosis, so we have to be careful when we are using them interchangeably. I haven't gotten in the back.
Yeah, I just thought this was an interesting correlation about people who are unaware and also the increase of the cause of death.
Mm-hmm.
As a funeral worker, I'm going to tell you that there's only certain listings that are your
Yeah.
primary cause. And so if we look back and say when the CDC started allowing people to cause or list a cause as Alzheimer's,
Mm-hmm.
it's actually just a few years prior to Lewy body dementia. So
Yeah.
you're not going to see that incident becoming the norm until
Mhm.
we're a little further down the road. And that's the part that's crazy, because you think that we should have that figured out, but honestly, it's so much is controlled about what's the allowable cause of death on a death certificate,
Mhm.
which also falls and dovetails right into the factor that some of the physicians just aren't calling it that.
Yeah, and
We see that all the
Mhm.
time. So Lewy body, another dementia form,
Mhm.
wasn't even accepted or called Lewy body by the CDC.
Yeah. Pick's disease.
Right, for
Mhm.
12 years.
Yeah.
12 years ago, so that's the only time now you're just starting to see it, but before that, they were labeled something else.
Mhm. And that's a huge piece, or a huge opportunity for advocacy, bringing it back. There are so many things that we could be doing differently to ensure that folks are, getting a diagnosis, that they have the proper treatment, that families get, closure. So having, that as the primary reason, for death, primary cause of death, that could be a campaign in and of itself.
But that's a state issue, not a federal issue, because every death
Yep.
certificate is issued by the state,
Mhm.
through the state, not through the federal government. So then you've got a whole different bailiwick.
Yes. And I'm trying to keep track of time. I will say that even though a lot of these policies that I talked about are at the federal level, the Alzheimer's Association, we're also working a lot at the state level. The Cleveland area chapter works with the 6 other chapters in Ohio to form the Ohio Council of the Alzheimer's Association, and we are the unified voice for statewide policy. We do a lot of work around the state budget. How many of you know that we have an Alzheimer's respite line item in the state budget? Okay. How many of you know that it's been funded for the past 8 years? Okay. Want to guess what happened this past budget cycle? Huh? It did not get cut. We got a 25% increase. Yeah, I'm over the moon. And the only reason why that happened was because of our advocates who went down to the State House and who shared their personal stories with their legislators. And, you know, as much as this policy stuff can get really wonky and as many statistics as we can throw at our legislators, it's those personal stories which really make a difference. I just have one last story that I want to share. And I didn't even get to really talk about research, so at our Memory Day, which is our state trip to Columbus this past year, we brought 50 advocates from the Cleveland area down with us. And there was a couple from our early stage program who came. They were very nervous about coming. The husband has Alzheimer's, the wife is his primary caregiver. And she kept on calling me, like, are you sure this is appropriate? Are you sure he's going to be okay? Are you sure I'm going to be okay? And she would call me like weekly up until the program. And they got there. This gentleman, he was the sweetest man ever. For the luncheon reception, the Director Berman of the Ohio Department on Aging asked her employees to stand up and be recognized. This gentleman stood up and clapped as well. He thought the State House that they were in an airport because of all the steps and the elevators. And there were moments where he was there and where he wasn't. But then they met with Senator Eklund, who is the Geauga area senator, and they had the opportunity for a photo with the senator. And so the team that met with Senator is standing for the photo with him. And in the photo, I saw the photo afterwards, and this gentleman, everybody's looking at the camera, and this gentleman is looking off in the distance somewhere. And one of my coworkers who was supporting the team said that the Senator Eklund's staff member was the one who took the photo. And apparently she had the camera up to her eye and was about to say something to the gentleman to like, oh, look towards the camera. And then she thought and realized this gentleman has Alzheimer's disease. Asking him to look at the camera is not going to make a difference. The fact that he's there and he's participating and being present was the important piece. So they took the picture, and to me that story just gets it, pulls at my heartstrings, because that's what it's about with advocacy. It's about being present regardless of your situation and sharing whatever it is with our legislators, because some still have the misconception that Alzheimer's disease is somebody in the hospital bed on a ventilator, which we know is not always the case. We're seeing, I think, maybe less and less of that. So our legislators need to see folks who are still ambulatory, still fairly independent, like this gentleman who was able to come with his wife to Columbus for a day, and he was able to share his name with his legislator, and he held his wife's hand the entire time. So that was really important. One last thing, how much time do I have?
You're so over.
I'm so over, okay. Okay, so one last thing. In your packets, there are 2 pieces of information. Should be on the top when you open up the booklet. there is a trial match postcard. How many of you have heard of trial match or familiar with trial match? Okay. Trial match is a matching service. It is free for finding out what clinical trials you're eligible to participate in. That's all it is. So the issue with research right now is we have so many clinical trials that are being done. We don't have enough people that are enrolled in these trials. So the message to me is if Congress is funding and appropriating research, we need to do our part as citizens and constituents and participate in these trials. The trials are available for folks who are healthy, who maybe have a family member with Alzheimer's disease, who may be looking at lifestyle. So maybe if you have diabetes, that is a specific trial that is available to you, and they're going to look at maybe some biomarkers. So I would encourage you all to fill out that postcard for Trial Match. You can also access Trial Match, the matching service, online, or you can also call our 1-800 number and access it that way. That's one piece. And then the last piece, which should be on the top, is make your voice heard. That is signing up to be an advocate with us. That is the primary way that you will learn more about any upcoming policy priorities that need to be acted upon, any events that we have regarding public policy or legislator awareness information. If you sign up to be an advocate with us, you will receive 1 to 2 emails a month. Depending on the political climate, you may receive more. For example, just this past couple of weeks, how many of you heard about the appropriations for NIH research? Okay, few. I sat and watched the appropriations hearing the entire day at work, so yeah. So just a quick thing, the House approved $300 million additional dollars for Alzheimer's research at NIH, and then the Senate said, well, we're going to do $350 million. Yeah, and again, as advocates, when we were in DC at the end of March, we asked for 300, and that's what we got, and then we got more. So the more voices we have that are asking for funding, that are asking for increased parent support, the more we're likely to get it. So I would encourage all of you to join us in becoming an advocate. Join the 4,000 advocates just for the Cleveland area alone. We have, thousands of it across the country, and that's only going to grow, and it's only going to become more important that you advocate for Alzheimer's in the future. So I'm over my time, but thank you, everybody, for the questions.
Will you stay around?
Absolutely.
Yeah, I'll stick around. All right.